The skin is our first line of defense for infection. And infection we take very, very seriously in total joint replacement surgery. That's our worst possible case scenario, is to get an infection in a brand new joint. It's just something we don't want to see. So part of this is on you as you prepare for your surgery. Just be aware, no cuts, no scrapes. Ladies, with your shaving the legs, please be aware, use one of those razors that can't nick you, okay? We don't mind fuzzy legs here. That's a normal thing. Now about medications. This is another big safety thing. If you don't already have a list made up of your medications that you take at home, please, please, please go home tonight and make one up. We're going to ask for it about, 100 times. We do like you to include any allergies that you might have to medications on there. And then with the listing of the medication, take your pill bottles and read them off and list the name, the dosage, and how often that you take them. That's a complete medication list. And we'll be asking for that at the pre-op appointment. So certain medications you do have to stop before surgery. Typically 7 to 10 days before surgery, you need to stop things that thin the blood and certain anti-inflammatory medications. Okay, so people that are on Coumadin need special instructions from their surgeons. That's a very powerful medication that requires a lot of adjustments. So please talk to your doctor about Coumadin if you do take that. You do need to stop aspirin, Plavix, medications that thin the blood. We will be putting you on a blood thinner after the surgery as well, but before the surgery, those need to be stopped. All of the surgeons' offices will be sending out a list of the different medications that need to be stopped. So you can look through your list and compare them with the list that the surgeon gives you, so you know which ones you do have to stop 7 to 10 days before surgery. It is usually okay to take Celebrex and Tylenol. So Tylenol products, things like Norco, Vicodin, those types of medications are very common with people with arthritis. So those you can still take. But we'll let you know if there is a particular medication that you need to be stopping. So the day before surgery, hopefully you know where and when you should be there. But you can always call me just in case you left that piece of paper behind or can't find it. You can call me to verify the time of your surgery and the time of your check-in. Check-in's usually 2 hours before the surgery starts. The general rule for all surgeries that involve anesthesia is no eating or drinking after midnight. That includes gum the morning of surgery. So one of the complications of anesthesia is nausea. So the anesthesiologists don't want you to have anything in your tummy that's going to upset you. So that's why we do that. Now there are certain things that you can take the morning of surgery, and we can get into that later. When you come in, you can bring a bag of belongings with you with some bare minimum stuff. Now we provide the basics here at the hospital: toothbrush, toothpaste, soap, little bath basin, that kind of thing. But if you want to bring in your personal items, that is fine with us. This is one of the unique things about the Total Joint Center, is that after the surgery, you get to wear whatever you want. You don't need to wear the hospital gown as you're walking down the hall with the little breezy flap in the back. So bring in some clothing, some loose-fitting, comfy things that you would work out with physical therapy. So things like shorts, t-shirts, sweats, lounge pants, those all work very fine as long as they're loose and comfortable. You can bring them in as you check in for surgery, or you can have your guide bring them up later on once you get into the room. If you bring your belongings into the pass unit, we'll just put them right over into the nurse's station and into the room that's assigned to you after the surgery. We do request that you only bring battery-powered items. Anything that requires a plug-in needs to be checked with our engineering department. So easier just to leave those kinds of things at home. Now, if you have anything valuable, you probably don't want to bring them into the hospital either. So nice jewelry, nice clothes, large amounts of cash. You just leave those things at home. You don't need them here in the hospital. Now, here's the fun part. What happens in the hospital? The day of surgery, we do not want you to take any diabetic medication. So if you are diabetic, please do not take your insulin or oral medications the morning of surgery. You're not going to be eating or drinking, so your blood sugar will be low enough as it is. So we don't need the medication to add to that and drop it even further. So don't take diabetic medication the morning of surgery. You report to the surgical check-in area. It's called the PASS unit, which stands for Pre-Anesthesia Surgical Services. It's up on the second floor right next to orthopedics unit. You report in there and get up on a gurney with your little hospital gown, and then I say it's the hurry up and wait game. Behind the scenes, what's going on is that nurse is going through your chart and making sure all of the ducks are in a row. All of the T's are crossed and the I's are dotted. So this is for your safety, and we need to make sure that all of the paperwork is in order. So you wait a little while, and then the nurse comes in and starts your IV. Get some fluids running. Then you talk with the anesthesiologist. This is typically the first meeting with the anesthesiologist unless you request otherwise. If there's any last-minute lab work to do, also, that can be done right there in the PASS unit. Any last-minute signing of paperwork to do, that's done right there. You talk with your anesthesiologist, and usually that's about a half hour before surgery. So you know you're up next when the anesthesiologist comes to talk to you. Now, family is okay to wait in there with you. We do limit the numbers of people in the PASS unit. But right after you go into the operating room, we'll show the family members into the surgery waiting room. And as soon as the surgery's finished, the physician will be out into the waiting room to talk to family to let you know what happened with the surgery and how it went. I'm going to touch a little bit on the anesthesia involved with total joint surgery. And I keep it pretty basic because that's the anesthesiologist's job to talk about all of this stuff with you. But there's really two forms of anesthesia that we can use for total hip or total knee surgery, and that's general anesthesia. That's kind of the old school way of doing things. That's very appropriate in certain people. That's when you get some medication through an IV or a mask, sometimes both, and it completely knocks you out to the point where that's the type of anesthesia that they have to put the tube down your throat and put you on a ventilator during the procedure. After the procedure's done, the tube comes out, ventilator's off, and you're breathing on your own. There tends to be more side effects with general anesthesia, things like nausea and respiratory problems. So it's not always used. What we tend to use the most is called regional anesthesia. So a spinal anesthetic, kind of like the epidural that the ladies get before they give birth to their child. Something kind of like that, where the anesthesiologist finds the location as you're sitting on a table, they numb it, and then they inject medication so that you go numb from the waist down. Now, included with this spinal anesthesia is also some form of sedation. This is not a procedure that you will be awake for. So that's very important to know. Don't be afraid of the spinal because you think you're going to be awake during the procedure. That's a common misconception. You will be sleeping. And the way we run our operating rooms also here is that anesthesiologist is never leaving your side. They're sitting right up front, right next to your face, and even if you twitch an eyelash, they're right there to give you some more medication to get you sleeping again. Now, for knee surgery, there's a very nice form of anesthesia called a femoral nerve block. This is the golden standard for knee replacement. What this is the femoral nerve runs down the front part of your leg, kind of like the sciatic nerve does the back. The femoral runs down and hits that front part of the knee. And when they inject medication into that nerve, that will give you complete pain control for 12 to 24 hours after surgery. And that is the time when people have the most amount of pain. So we just knock that. It's a beautiful thing. This is how we get people up and walking down the hall the same day of surgery. Now, there is a safety thing to this type of block. And that is when they do it, your big muscle, the big quadricep muscle in the front of your leg there, that is pretty much useless to you while this is in effect. So when you go to stand up, we will be putting a straight leg brace on you to keep your knee from buckling out from underneath you and falling. So that's a big safety feature to keep in mind. Anytime you get up for that first day, you need to have the knee brace on.